All right, let's start with the ventilator because it tends to scare everybody for whatever reason, right? So what is mechanical ventilation at the end of the day? What is it doing? It's very simple.
You're breathing for the patient.
Yeah, and you're literally just pushing air into the lungs, right? Pushing air in. That's it. It's positive pressure ventilation. Okay? So, what are the four, aside from the mode of ventilation, so you have mode here, we'll talk about some modes, what are the four things that you're concerned about when you're doing your settings?
The respiratory rate.
Okay, so respiratory rate,
Tidal volume.
tidal volume,
FiO2.
FiO2,
And PEEP.
excellent, and PEEP. Okay, and I like the order that you stated these in because which two account for ventilation and which two account for oxygenation?
The first two are for ventilation.
Excellent. And so we talked about, and ventilation is going to affect which parameter on your blood gas?
CO2.
Exactly, the CO2. And so we talked about yesterday during rounds, what do these two together equal? Yeah, the minute ventilation, okay? So that's very simple to keep that, you know, at one idea in your mind. And then which two affect oxygenation?
The last two.
Yeah, the PaO2. So the FiO2, what are we breathing right now? What percent?
21%.
Yeah, so room air is 21%. And then what's the most I can get this thing to go up to?
100.
100%. And that's when, like we said, we're in trouble. And what's the way I really determine if someone is in trouble or not? What formula do I use?
RSBI.
That's you. So he just said RSBI. So that's what?
That's going to be the respiratory rate over the tidal volume.
So that's the rapid shallow breathing index. Is that for what we're talking about, or what's that specific for? Extubation, right? So that's a parameter we can use to look towards weaning towards extubation. What's the thing that I'm talking about to determine if like a patient's in trouble or not? Exactly, the PF ratio. So what is the P?
PaO2.
The PaO2, and again, that comes from your
ABG.
ABG. And then what is the F?
FiO2.
FiO2, right? So above 300 is where we want to be. What would yours be right now, for example, if I drew a blood gas on you right now? Just quick and dirty.
Maybe like 400.
Yeah, 500. So maybe your PaO2 is 100, keep the number simple, and you're breathing